Wow. My name's Eric Swanson, and welcome to my demonstration of my healthcare dashboard. Before we begin, I want to talk about why this dashboard was important. You see, the country and each state individually has very different statistics when it comes to talking about healthcare. Some states spend more on healthcare, some spend less. Some have very radically different race profiles that leads to some races having more insurance than others. Some states have different hospital settings. Some states have very different things when it comes to how many people are dying, the spending overall, and the breakdown of the spending. Every state is individual, and it is important to look at specific states to kind of get an idea of what's going on with the country. I chose this topic because it's very important for everyone to understand what they are getting when it comes to healthcare in this country. You see here, you can see the yearly deaths in the United States and the uninsured by race in the United States. You see that the yearly deaths have increased every year from 2014 to 2019. We do not have data for 2020 and beyond, but you can see a stuttering trend with the number of deaths each year. You can see that in the United States, Hispanics have the highest rate of uninsured in the United States. And by clicking on it, you can see how many Hispanic people have died between 2018 and 2021, with over 300,000 dying in 2021 alone. You see here, you can see a heat map of each year and how certain diseases have killed off people, they, which includes that uh, certain diabetes have low rates, low chronic respiratory might have a higher rate, and heart disease is very low. You can see with the healthcare trend that we're spending over $3 trillion per year. And if you notice, the personal healthcare has increased per year, year after year. Yet the actual spending hasn't actually increased that much over the last few years. You can see how many hospital beds per thousand, and you can see that most hospitals in the United States are actually nonprofit hospital with over 1.65 beds per thousand population for nonprofits. And you can see a trend of most drugs being filled commercially with very little being done by cash. Now I want to look at a few states and show you how different they can become. If you look in New York, you can see that the number of deaths are stabilized and a very high population of Hispanics are uninsured. This makes sense when you think about New York City and the high amount of Hispanics that are living on welfare in the state. You can see spending is in the billions. You can see population has increased, and you can see a massive increase in expenditure of hospital care over the last 20 years. One of the interesting topics is how much cash is spent on drugs compared to Medicaid, commercial, and other ways. New York is one of the only states that I could find that do not have any for-profit hospitals in the entire state, which means that this entire state is funded between state and local governments and nonprofits. Looking at Florida, you can see some different trends. You can see that Hispanics do make up, but Caucasians make up a massive portion of Florida's uninsured population. You can see that that's increasing, but kind of stable. You can see spending is massively lower than other states, but the population has skyrocketed over the last few years, leading to a massive increase in spending on personal care and hospitals. You could see that almost all drugs in Florida are being filled commercially, and none are doing dog by cash. Minnesota is very weird because uh 2018 is here, and you can see that it has the highest amount of deaths in between 2014 and 2017, which is very intriguing if you look at how that shaped out. And almost the entire state's uninsured race breakdown is Minnesota, is white. Same thing with no non-for-profit and prescription drugs, and a lot of drugs being filled with Medicaid compared to some other states. California is very interesting because the deaths have stabilized yearly, and almost all people who are uninsured in California are Hispanic. And looking at Nevada, you can see that how the spikes and decreases you're seeing with the state is very intriguing. And natural causes, it goes from light to dog as we decrease throughout the years. And you can see how fast the population of Nevada has increased compared to a state like New York, which includes also the spending. I know this dashboard doesn't have a lot of interesting technology, but there's a lot of interesting information you can glean from looking at individual states and the country as a whole. Thank you for looking at my project and have a great day.